And joining us in our studio is Dr. Joe Congeni, sports medicine at Akron Children's Hospital. Dr. Joe, good morning.
How you doing, Disney?
I'm hanging in there.
Good.
I've got the old throat spray. I've been trying to. I think it's like laryngitis or something that I've had that I've been battling for the past couple of weeks. And I'm not sure what it is.
The weather's just ready to break through. You can tell that these spring sport athletes are about to get their chance to be on the big stage.
Oh, absolutely. And we've in talking about sports, let's go this over the weekend with the Final Four and some of these injuries. And we're talking about corneal abrasions.
Yeah.
What the heck is that?
Everybody was saying it, and nobody was quite sure what it was. It was the biggest thing I was being asked. The cornea is a thin membrane-like cover, transparent cover over the eye. And so it's very prone to getting scraped or scratched, and that's all an abrasion is a scrape or a scratch. And it occurs pretty frequently from now in basketball more and more. We see it in high school games, junior high school games, where people are raking trying to pull a ball free, and you'll get poked in the eye. The eye is actually the perfect object for which to poke the eye and scrape the cornea. So this thin covering. But the problem is it isn't always just a scrape or a scratch of the cornea. So there needs to be an examination. So you often see these people go off to the locker room for evaluation because there's other injuries. The globe, which is the eye socket, can get damaged with a bad hit or elbow or bad poke. The actual eyeball itself, the globe itself. So the socket, the globe, you got to check all those things first. Then you need to see how big this scrape is, and we have to do a thing called a fluorescein stain, where we put this material in the eye, and then you see exactly how big the scrape is. And then the third thing, you need to make sure there's not still a loose body in there. And if you have like a contact lens or a loose body that's in the eye, it can continue to make this scrape worse and worse. So those three things have to be done when you evaluate an athlete for a corneal abrasion.
I saw this maybe Ray Allen, maybe like 20 years ago, got his eye poked out. And long gone are the days where you just use a little Visine just to clear it out and we're all good. So it's this long process with this, huh?
Right. You know, that a lot of athletes tell us, again, you know, we've been talking about things like rib injuries are so painful. This is really painful, too. And if you saw the big center from Gonzaga, Karnowski, was really in a lot of pain when it happened. Remember, he went to the locker room. Even when he came back to the bench on Saturday, he looked out of sorts. Even Monday night, I thought still. Now, the good news here is most of these heal within 48 to 72 hours, so within a couple of days. LeBron had one, remember, about a week ago, and he struggled with his for a period of time. And so the treatment is where there's been a big change. We used to patch all these kids. They'd go to our emergency room and leave with a patch, and we thought what it would do was reduce the amount of blinking, because as they blink over and over again, it's painful. And the patches didn't work. They actually kind of made things worse.
Because, of course, you just want to continue blinking when you have something in there.
Yeah,
but
and they would pull it off, or it didn't fit quite right. It was hard to keep it fitting right. So the patch is gone. Nowadays, we use these antibiotic ointments as one of the things. If it's still very, very painful, there's a medicine that's a little bit more tricky as to how to decide to use, called cycloplegics. And what that does is it kind of paralyzes the muscles that allow you to blink, so you can't blink at all. You know, if you ever go and you get your eyes dilated at the doctor's office, but you, of course, would never put a cycloplegic in a guy that you think you might put back in a game.
Oh, yeah.
Because they're blurred and
that's
they can't
just done.
Do you know when you leave the eye doctor? Can you imagine trying to play a basketball game?
You can't even drive.
Yeah, so you can't drive. So that's a medicine that we really only save once we're sure there's no other damage. But antibiotic ointments are good for kids. Patching is no longer done. And then, because there can be scarring that occurs later, the recommendation is to wear goggles. Now, for all the young kids out there, how long did LeBron wear his goggles last week after he got...
Not very long.
I think it was 30 seconds or a couple of minutes.
Probably enough to get a picture, and that's about it. And say, that's LeBron with the goggles.
They're not comfortable, and so athletes don't keep wearing the goggles after. But a corneal abrasion, real common scrape or scratch of this membrane covering the eye, can be a worse problem. This fluorescein stain works really well, where you can see exactly how big the scratch is, and then you know exactly how to treat it.
Dr. Joe Congeni in our studio, and last night, speaking of the Cavaliers, Kyle Korver back on the floor, had a foot injury, was out for about 4 games, and This was, what was it, plantar fasciitis? Is that what happened in the foot?
Well, they are actually not mentioning it as plantar fasciitis yet from what I've seen. I've seen tendon injury, and I'm wondering what tendon. There's two other tendons that occur frequently, the peroneal tendon on the outside, posterior tib on the inside, but a tendon injury, 2 MRIs. They've looked at ways to treat it, to reduce the inflammation, orthotics to try to take pressure off it. One thing that never changes is that guy has a beautiful shot, doesn't he?
Oh, boy, doesn't he? But I'll say this, I have gotten plantar fasciitis, and whether it is or it isn't, it's very painful. You roll the golf ball on the bottom of the foot, but when you're talking about orthotics, I've heard this. Is it true, like if someone has flat feet, is it a good thing nowadays to make a little arch, or do you just leave them and just the way God made them and have them keep flat feet?
So the way God made them, as long as there's no injuries or problems, if they're not having a problem, the vast majority of flat feet or high arch are perfectly fine and no problem. If you're a guy like Kyle Korver or a guy like you that was struggling with being able to do much activity-wise, then one of the first things we can do that can help a lot is orthotics and getting the foot into a neutral position. And so orthotics can be a big benefit for us in sports medicine.
Dr. Joe Congeni in our studio every Wednesday. He's on at this time. Dr. Joe, thanks for coming on by.
Thanks so much. Have a great week without the big man, without Ray around.
I'm in the captain's chair, so yeah, we shall see. But thanks so much for coming on by.
Thank you.